So we've actually run out of time, and I do appreciate that, so I'm going to whiz through what actually I think is probably what we're all here for is children's cancer. And actually what we wanted to particularly do is we recognise that Francis appears like it's got some very generic messages, as had that YouTube video, but actually we want to almost reassure you and think about how we can translate those messages into the world of children's cancer. So a lot of this is what we've been doing for quite a long time now. We have a set of measures, our manual, our Bible if you like, that we have been using for a few years now. Francis talks about not having targets, and arguably are we going to then say that we've got this set of measures? This set of measures isn't just about targets. It's absolutely not driven by targets, it's driven by quality. And what is key is that we have this peer review process that underpins it. So that's why we put peer review right in the middle. Peer review, I always say, is very much like an Ofsted process. People seem to understand what Ofsted is in relation to education, although I know that the Queen actually referred to Ofsted in relation to healthcare targets when she opened Parliament a couple of weeks ago. So maybe we need to think about another way of likening this to what actually happens. But essentially, peer review is about going and hearing the stories. It's about going and hearing the stories of staff, looking at the systems, but we also have, more importantly, representatives, not just of expert clinicians. We have families and people that have been through the system help us review our services. And it's a formal opportunity, if you like, to actually review what is good, but also where we can improve. And that happens throughout the country within paediatric oncology. It happens in other areas too. One of the key messages is that we listen to the whole person, and it's not just one person listening to that person. Paediatric cancer, as you know, is really defined by the multi-professional teams that work within it, and therefore some of the messages and the stories that were heard by Francis were about individuals, and we hope that by the fact that we work as multi-professional groups with different people, with psychologists, with medical colleagues, with nursing colleagues, with the experts within those groups, that actually we won't be in that same situation. There are of course a number of other documents that help support our quality. The Cancer Reform Strategy, for example, actually states that we need to be ensuring that you have a voice. This is about families having that voice, and that we listen to all of you as a whole, not just that unintentional blindness, if you like, and focus on those individual symptoms. This, again, as Jackie mentioned, we've pinched this slide from somewhere else, but this is talking about this person on the left is actually saying that they didn't mind being that guinea pig. The important part of that process, they were having, it wasn't an oncology patient, but the important part was if they were informed along every step of the way of the process, that actually that felt okay. And I think we can have those messages translated into the oncology setting very clearly, where we talk about providing that information at every step of the way, and we acknowledge that the diversity and the breadth of people involved and the diseases that are involved, we don't get it right every time, but I guess I'm appealing to you to tell us when we don't get it right. The other kind of side of things to Francis was actually this transparency. And there are things in place where you as families can feed in your experiences. And I think this transparency is going to become more and more important. So a friends and family test, for example, on discharge, patients will now be asked would they recommend the service to their friends and family, and interestingly staff are also asked would they recommend this service to their families. Okay. This is quite an unusual slide. Again, it's not cancer specific, But this lad was going to have surgery, and I don't know whether you can read the bubble on the bottom where it says 2-0 down, 3-2 up, Arsenal. And he wrote that on his abdomen. And when he went under anaesthetic, the surgeon couldn't quite understand why he'd done that. But actually, they'd had a conversation pre-theatre about football. And what this lad wanted to ensure was that he was remembered as a person, not as the abdomen. I think that helps us really focus again, doesn't it? Francis spoke quite extensively about staff not being listened to. And again, there are some things here that absolutely happen in our organisations that hopefully we will never be in that situation again where concerns are not listened to. Okay, so just summing up, what we'd really like from this is about you, and Francis absolutely has far-reaching effects and messages, but we don't know what it means to you. We have ideas, but ideally what we would like you to do is, on the cards that are on your seat, is actually tell us what it would mean for you. How can we ensure that those dreadful things that happened and were reported don't happen for you? And we recognise that we're all from a variety of settings, but I think it would be really useful and informative if you can share some of your thoughts and ideas with us as professionals to help us get it right for more.